Good evening, everyone. Welcome to today's Health Talk organized by 365 Cancer Prevention Society and OncoCare Cancer Centre. I am Sayan, your host for tonight. Let me run through the flow for tonight's session. We will be inviting our main speaker, Dr. Lim Sheow Lei, who will be sharing with us on the topic Understanding Uterine Cancer and its Treatments. We will have a Q&A session at the end of the talk, so feel free to ask your questions in the comment section. We will address them at the end of the talk. Do remember to like and share this Facebook Live. Also, visit both our social media websites for 365 Cancer Prevention Society and OncoCare Cancer Centre. Kindly note that all information shared in this event by the speaker and 365 Cancer Prevention Society are for general information only and subjected to changes. Do consult your doctor for personalized and detailed medical advice. Thank you. We have an ongoing campaign called Let's Fight Cancer Together to encourage cancer patients of lung cancer, gynae cancer, and colorectal cancer to seek consultation on their medical journey and donate for a good cause. This campaign is brought to you by OncoCare Cancer Centre and 365 Cancer Prevention Society. The cost of consultation will be donated to OncoCare Cancer Centre and to 365 Cancer Prevention Society. And this is the campaign schedule for the specific cancer types. You can find out more on our Facebook page, including this schedule. These 3 health talks are provided by OncoCare medical professionals. A brief introduction on OncoCare Cancer Centre. OncoCare Cancer Centre is one of the largest and fastest growing private healthcare providers of oncology in Singapore. They stand by a vision of becoming a leading center in cancer care in the region and a mission of adding years and quality of life to all patients. OncoCare Cancer Centre provides patients with quality cancer care services and treatments administered by highly skilled, qualified medical professionals since 2007. They provide efficient, knowledge-based, integrated cancer care practices and personalized treatments. And these are the locations of OncoCare Cancer Centre in Singapore. And these are the awards and accolades achieved by OncoCare Cancer Centre. These are the services and treatments that they provide, which includes diagnosis and workup of cancer for adult patients, inpatient and outpatient treatment, cancer screening, and genetic counseling and testing. And these are the specializations of OncoCare Cancer Centre. As mentioned for the campaign, we will have medical professionals from OncoCare Cancer Centre as Facebook Live Health Talk speakers for the campaign period. Do stay tuned to our Facebook page to find out more information. We will now invite Dr. Lim Sheow Lei from OncoCare Cancer Centre. She's a senior medical oncologist with a special interest in treating women's cancer. She will be here to share with us on the topic Understanding Uterine Cancer and its Treatments. Uterine cancer is the 4th most common cancer affecting women in Singapore, and its incidence is rising. When detected early, the chances of cure is excellent. Tonight, we will be learning more about uterine cancer and the treatment options available for this cancer type. Without further ado, I will now pass the time to Dr. Lim.
Thank you, Sayan, for the kind introduction. I would also like to thank 365 for the invitation. Good evening, everyone, and thank you for tuning in. I'm Dr. Lim Sheow Lei. I'm a medical oncologist with the OncoCare Cancer Centre and have a special interest in the treatment of women's cancer. Very often, women are by nature carers and providers. We care and provide for our family, our spouse, our children, our parents, our grandchildren, to the extent that sometimes we are so busy caring for other people that we ignore our own health. Today, I'm going to talk about uterine cancer, the most common gynecological cancer affecting women in Singapore. Most women with uterine cancer will beat this cancer, especially if it's detected early. The most common reason why there's a delay in seeking medical treatment very often is due to a lack of awareness of this cancer. Uterine cancer is the 4th most common cancer affecting Singapore women. The number 1 most common cancer remains breast cancer. The incidence of uterine cancer is rising and has actually been steadily rising over the last 20 years. 20 years ago, it used to be number 8 on the list, and over the years, it has actually overtaken all the other gynecological cancers such as ovary cancer and cervical cancer to become number 4. And we think that the reason why the incidence is rising is because of the urbanized and westernized lifestyle that Singaporeans have adopted in the last 10 to 20 years. Okay, let's get acquainted with the female reproductive organs. It is situated at the lower part of the abdomen called the pelvis. It comprises of the uterus, or more commonly known as the womb, and this is where the baby is being housed when the woman is pregnant. On either side of the uterus are the ovaries. The function of the ovaries are to produce the female hormones and to produce eggs. As we age, the function of the ovary also declines. At some point in time, it will stop producing the eggs, and will stop also producing the hormones. And that's when a woman goes into menopause. At the lower end of the uterus, where it joins the vagina, is the cervix. The cervix is a different organ from the uterus, and the cancer of the uterus and the cancer of the cervix they are actually very different cancers, but very often confused by many patients. Uterine cancer are cancers that begins or arise from the uterus. Most of this cancer, in fact 95% of these cancers, arise from the inner lining of the uterus. The inner lining is also known as the endometrium. Therefore, uterine cancer very commonly is also called endometrial cancer. Less commonly, cancers can also arise from the muscle layer of the uterus. These type of cancers are called uterine sarcomas. These are different cancers, and today my talk is going to be focusing on the endometrial cancer, which is the most common type of uterine cancer. I will not be talking about sarcoma. So cancers are caused by damages to the genes in our body, or what we commonly call gene mutations. The genes are like the instruction manual in our body. It actually decides whether we have our father's nose or our mother's eyes, but more importantly, it ensures that our body functions properly. Some genes protect us from cancers, and if these cancer protective genes get damaged, or they're what we call mutations, there's a higher risk of getting cancer. So what causes gene mutations? Aging. If we inherit a cancer-causing gene, there are some environmental or lifestyle factors that can also cause gene mutations. So as we grow older, the risk of gene mutations becomes higher, and these mutations will accumulate over time. Our body also becomes less able to actually repair these damaged genes. Therefore, the risk of getting many cancers, including endometrial cancers, tends to rise as we get older. 7 out of 10 endometrial cancers are diagnosed after the age of 50, but it can happen at any age. We do see patients as young as their 20s being diagnosed with endometrial cancers in our clinic, although that is a bit less common. Okay. Another important risk factor for endometrial cancer is the hormonal imbalance. Okay. The ovaries in our body produces 2 hormones, estrogen as well as the progesterone hormones. The estrogen and the progesterone hormone needs to be balanced in order for us to maintain a healthy endometrium lining. Okay? Problems arises when there's too much estrogen or insufficient progesterone. This results in excessive growth and thickening of the uterine lining, which over time can become cancers. Overweight, and therefore any condition that causes an extra amount of estrogen in our body, increases the risk of endometrial cancer. Being overweight and obese are one of the major risk factors for endometrial cancer. It increases the cancer risk by about 2 to 3-fold. Many of us are aware that the ovaries produce the estrogen. What many people may not be aware is that the body fat in our body can actually be converted to estrogen, explaining why the incidence of endometrial cancer is much higher in this group of women. Being overweight and obese is also associated with many other medical problems, such as diabetes, high blood pressure, and this group of women tends to be less physically active. And this is the typical profile of endometrial cancer patients that we see in our clinic. So there are other conditions that can also result in excess estrogen in our body. A woman who starts her menstrual period young, before the age of 12, and have late menopause are also at a higher risk of getting endometrial cancer. This is because the body is subjected to more fluctuations in the hormone and more exposure to the estrogen. Tamoxifen, which is a drug used for treating breast cancer, also increased the risk of endometrial cancer. The reason for this is because although tamoxifen acts to block estrogen in breast cancer tissues, it acts like an estrogen in the uterus, resulting in a slightly increased risk of endometrial cancer in women who takes this. If women decides to take hormone replacement therapy because of the menopausal symptoms, it's best to use a combination of estrogen as well as progesterone, okay? Because this is actually safer for the endometrium. Estrogen-only hormone replacement therapy has been shown to increase the risk of endometrial cancer. Polycystic ovary syndrome is a medical condition whereby a woman has difficulty ovulating, okay? A result of which is the fact that they will have hormonal imbalance inside their body, having more estrogen once again and less of the progesterone. This condition is also often associated with obesity and subfertility, which further increase their endometrial cancer risk. So how do we protect ourselves? We need to bring down the estrogen and increase the progesterone. So we need to try to avoid getting obese and getting overweight. So maintaining an ideal body weight is important through exercise, through a healthy diet. Having children and having more children also protect us from endometrial cancer. This is because during the pregnancy, the progesterone hormone level is actually higher. Using a birth control pill also helps to normalize and kind of correct the hormonal imbalance in our body, and has been shown to protect us for endometrial cancer as well as ovary cancer. Okay, so the incidence of endometrial cancer in developed countries is rising, and we think this is largely due to increased incidence of obesity, diabetes, and hypertension in this country, and also because of the fact that people in developed countries probably have perhaps a more sedentary lifestyle. They are less physically active. They also perhaps choose to have fewer children or not even having children at all. And we anticipate that the incidence is likely to continue rising in the coming years. So 3 out of 100 endometrial cancers are in fact hereditary in nature, which means that majority are not. This is what we call a Lynch syndrome. There's an inheritance of a mutated copy of a gene called the mismatch repair gene, and we call this MMR in short. This could be inherited either from our father or from our mother. Okay, and there is also a 1 in 2 chance of passing this mutation on to the children. Lynch syndrome increases the risk of getting endometrial cancer. All right, there's a up to 60% real lifetime risk of getting endometrial cancer if you have Lynch syndrome. They also increase the risk of other cancers other than endometrial cancer, in particular colon cancer, up to 70% lifetime risk, so it's pretty high. Other cancers include ovary cancer, stomach cancers, pancreas cancers, and cancers of the urinary tract. Many of my patients will ask me, since I already have endometrial cancer, why do I need to know whether I have got Lynch syndrome as well, given the fact that it's actually not very common? The reason is because other than causing endometrial cancer, a person can also be at risk of other cancers that we mentioned earlier. Not only that, their relatives may also be at risk. In patients with Lynch syndromes, we can actually do something to help them reduce their cancer risk, such as doing cancer screenings to try to pick up cancers that early, or pick up cancers before, or pick up tumors before they become cancer, such as doing colonoscopy screening to look for colon cancer. Aspirin may also help to reduce the risk of colon cancers in people who have got Lynch syndrome. Some people may even choose to undergo surgeries to prevent the development of cancers. Now, knowing the Lynch syndrome nowadays may also make a difference to how we treat the endometrial cancer. Endometrial cancer that is associated with Lynch syndrome can respond very well to a new type of anti-cancer drug called immunotherapy, which we will talk about it a bit later in our talk. So cancer risk factors are things that increase our risk of getting cancer. Having a risk factor or factors does not always lead to endometrial cancer, however. Women without any known risk factor can also develop endometrial cancer. Okay, so what are the red flags of endometrial cancer? the most common presenting complaint in women endometrial cancer is abnormal vaginal bleeding or passing out watery blood stain discharge through the vagina. In premenopausal women, this can be vaginal bleeding or spotting in between their menstrual periods or experiencing unusually heavy menstrual periods. In postmenopausal women, vaginal bleeding is never normal and they need to go and see a doctor soon. Okay. Many women that we see in our clinic, a lot of times, may delay going to see a doctor for many months and sometimes even years. When you ask them why is that, one of the most common reasons they give is the fact that because they are very embarrassed to go and see a doctor with bleeding from the vagina. This is especially common in the more older women. The other reason they give is because they really don't want to know, because to them, being diagnosed with cancer equates to a death penalty. Now, the good news is that very often, abnormal vaginal bleeding is a very, very early sign of endometrial cancer. When the cancer bleeds, because the uterus is actually communicating with outside of the body, so this bleeding can be picked up quite early. So abnormal vaginal bleeding is present in the majority of women, up to 90% of women with endometrial cancer, and as we said earlier, is usually an early sign. However, the majority of abnormal vaginal bleeding is in fact not due to the cancer. In premenopausal women, about 1% is due to endometrial cancer, and in postmenopausal women, incidence is higher, it's about 10%. Nevertheless, we still advise women with abnormal vaginal bleeding to go and see their doctor, because if we can pick this cancer up early, there is an extremely good chance, up to 95% chance, that we can cure this cancer. Okay, what are the other symptoms? As the endometrial cancer grows bigger, it can put pressure on the surrounding organs, such as the bladder and the intestines. This can result in difficulty passing urine or difficulty passing motion. Women may also complain of pelvic pain or painful sexual intercourse. If a doctor suspects endometrial cancers, there are a few investigations that they will want to order. And the first investigation they usually do is what's called the ultrasound scan. Right, this ultrasound scan is using sound waves, very similar. This is actually like the scans, the jelly test they use in pregnant women to look at the endometrial thickening, all right, as well as to see whether there's abnormal growths in the uterus. To confirm the diagnosis, we need to take tissue sample from the lining of the uterus, send it off for test to see whether there's cancer there. Right, once the cancer diagnosis is confirmed, the doctors will very likely order further tests in terms of scans, looking to see if the cancer has actually spread. Okay. How do we treat endometrial cancer? There are three main pillars of treatment. Number one, surgery, radiation treatment using high-dose X-rays to kill cancers, and also drug therapy. Now, surgery removes the cancer in the uterus. At the same time, they also remove the ovaries, the fallopian tubes, as well as the cervix and some of the lymph nodes in the pelvis. This will be sent off to the laboratory for testing to check if cancer has spread to these areas. And this is what we call staging. Okay. Following the surgery, we'll be able to give a stage to the cancer. Okay, stage 1, 2, 3, and 4. Stage 1 cancers are the earliest cancers where it's still limited to the uterus. And stage 4 cancers are cancers that spread, say, to other different parts of the body, such as the lung, the liver, etc. Fortunately, 7 out of 10 endometrial cancer are stage 1 at diagnosis. So most of these cancers are discovered early. How do we treat these cancers? For cancers that are stage 1, 2, and 3, the main treatment is surgery. However, in patients with stage 2 and 3 cancers, you may need to add in radiotherapy as well as chemotherapy after their surgery. 5-year survival, very, very good in stage 1. Not bad in stage 2. Okay, it then drops when it comes to stage 3 or stage 4 cancers. 70% of women with endometrial cancer will beat the cancer. To make your chance of beating the cancer better, okay, important thing is to actually pick it out at stage 1. Therefore, go and see a doctor early, whereby most of the time the cancer can be cured. We're now going to move on to metastatic cancers. Metastatic cancers are cancers that have spread from the uterus, where it starts off, and it has gone to other parts of the body. About 10% of endometrial cancer patients, unfortunately at the time where they present, already have metastatic cancers, or what we call stage 4 cancers. Cancers that have been treated can also come back or recur. We call this recurrent cancers. And when cancer come back, they may not always come back in the same spot as the original cancer. And very often this can actually go to other organ parts. The more common organs that endometrial cancer spread to are the lungs, the livers, the bones, and also in the abdominal cavity. Unfortunately, for this group of women, the outcome may not be so good, and then less than 20% of these women will be alive in 5 years. Right? How do we treat this group of cancers? The main treatment is drug therapy. Surgery is less helpful because these cancers have already spread. So we need a drug that can go around the whole body and reaches different parts of the body where the cancers are. The aim to control the cancer growth, and in so doing, we try to improve and relieve the symptoms caused by the cancer, and also to help to extend the patient's survival. Unfortunately, when patients have metastatic cancers, very often cure is not possible. And how do we treat these cancers? For the longest of time, the main drug treatment that we use is chemotherapy. Cancer cells actually divide and grow faster. So chemotherapy works against these fast-growing cells. But the problem with chemo is that it cannot differentiate between what is a fast-growing cancer cells and a normal healthy cells that is growing fast, resulting in many of the side effects that we are familiar with chemotherapy. Most women are very fearful of chemotherapy because it has got a very bad name because of what we read in the internet, or perhaps what we watch on TV. But the good news is that the type of chemotherapy that we use in treating endometrial cancers is in general quite well tolerated. There are different types of endometrial cancer. Okay, the endometrioid, which is the most common type, the serous, and the clear cell. Okay, when we look under the microscope, you don't need to be a doctor to tell that these different type of cancers actually look very different. So it's not surprising if I were to tell you that all these cancers behave in very, very different way. What makes this cancer grow is also very different, even within the same type of endometrial cancer. But for the very longest of time, we have been treating all these type of cancers using the same method, i.e. with chemotherapy, which is probably not very ideal. In the last few years, we're becoming more and more aware that endometrial cancer is probably not just one single disease. It's actually a very diverse disease, although all this cancer starts from the uterus. With advancements in medical technology, we are now able to do tests to actually find out what is causing this cancer to grow. All right, and this is what we call molecular testing. And based on these results, we can select what is the best treatment, all right, for each individual cancer. For example, you can use the cancers that we actually remove during surgery and do tests on them. Cancers that has extra estrogen, too much of estrogen can make the endometrial cancer cells grow. Likewise, having too much of this protein called the HER2 proteins makes the cancer very fast growing and very aggressive, and having the Ntrk proteins does the same thing. What these proteins do is the fact that it switches on the cancer growth. The cancer will keep growing and it actually doesn't stop. So the analogy here is about people who drive will know, if you put your foot on the accelerator pedal and you just keep putting your foot there and you don't remove it, the car will keep going forward and it doesn't stop moving. So what can we do about this? We can then design drugs that specifically block these bad proteins. Okay, right? This type of treatment are called targeted therapy. So we can use drugs to block the excess estrogen, or we can also give a woman progesterone treatment, like we said, to balance out the excess estrogen. There are also drugs available now that specifically block the HER2 proteins so that it stops it from making the cancer cells grow. Having the Ntrk protein is actually not so common in endometrial cancer, but if it is present, it is very good news, because nowadays we have got a new class of drugs that specifically work very well for this type of cancer that has the Ntrk proteins. It's a very, very effective drug. As these drugs are more effective, are more specific, they tend to work better compared to chemotherapy against the cancer cells, and very importantly, it's less likely to cause harm to the healthy cells compared to chemotherapy. They don't tend to have the classical side effects such as hair loss, nausea, vomiting, and the suppression of the immune system, unlike chemotherapy. Okay, now I'm going to move on to another type of new cancer treatment called immunotherapy. This is a very exciting type of anti-cancer treatment. It's a drug therapy that boosts or energizes our own body immune system and let our immune system go and better recognize and get rid of the cancer cells. In 2018, two scientists, Dr. Ellison and Dr. Honjo, were awarded the Nobel Prize in Medicine for their work in immunotherapy in cancers. Okay, our immune system defends us against foreign invaders such as viruses, the bacteria, and also cancer. It is able to recognize what is foreign invader versus what is part of our own body. So it will attack the foreign invaders and leave our own body alone. And what is also special about immune system is the fact that it has got a good memory. It can remember these foreign invaders even many years later when it re-encounters them. So we develop immunity towards these foreign invaders. However, cancer cells can be very, very devious. It can find ways to escape and hide from the immune system. And one of the ways it does it is by producing a protein called the Pdl1 protein. When this protein is present, it will attach itself to the PD1 on our immune cell. And this effectively sends a signal to our immune system that it is part of our own body and therefore do not attack me. Okay? So clever scientists have also come up with drugs that we can use to prevent the PDL1 from attaching itself to the PD1. Now, this type of drug is called immune checkpoint inhibitor. In so doing, the cancer cell have nowhere to hide. Okay, so the immune system will be able to recognize it. Okay. Immune checkpoint inhibitor has been used in clinic to treat various types of cancers for about maybe 4 to 5 years now, including things like lung cancer. The treatment is used in treating endometrial cancer is probably only about 2 years plus 3 years. But it has in fact revolutionized the way we treat endometrial cancer. So compared to chemotherapy, cancer control can usually be quite dramatic and can last longer, like we said, because of the immunomemory. Some of this cancer control can last for years. These are short infusional treatments that's administered in the clinic, right? The side effects are due to an overactive immune system, and most of the time it is actually quite mild and quite well tolerated. So, but not every patient will benefit from immunotherapy. Tumors that has the mismatch repair or the MMR gene mutations respond well to immunotherapy. And we recall that patients with hereditary Lynch syndrome also have this mutation. Okay, so in body, when our cells divide, the DNA, which is our genetic code, needs to be copied over. When it starts copying over all this DNA, mistakes can happen. Okay, for example, G that's supposed to actually pair with C pairs with the G instead. These are what we call mismatched DNA. When there are presence of mismatched DNA, it needs to be corrected. All right, this is the job of the MMR gene. They act like spell checkers to correct these typing errors. Okay. However, if there's a problem with this MMR genes, when it's not working, it's mutated, it's faulty, this results in accumulation of a lot of these mismatched DNAs, large quantities of this. Therefore, tumors that has got this MMR gene mutation tends to have a lot of mutations. Now, this is a normal cell, a cancer cell, and a very highly mutated cancer cell, lots of mutations. As you can see, it actually looks very different from the normal cell compared to a cancer cell which doesn't have a lot of mutation. When it's very highly mutated, it becomes more recognizable by the immune system because it looks different, all right? And the immune system will be able to recognize it and attack it and get rid of it, all right? MMR gene mutation is present in 1 in 3 endometrial cancers, including the hereditary Lynch syndrome. How do we know whether a tumor has the MMR gene mutation? We can do the molecular test. So we do tests on this tumor to check if the mutation is present, as we discussed earlier. Okay, so those patients with MMR mutation, okay, with metastatic disease, if you treat them with this immune checkpoint inhibitor, that is a 1 in 2 chance that the cancer can shrink down. And all of these cancers which shrink down, 2 out of 3 cancers remain under well control, 3 years or 3 years or longer. Now, this type of result is actually quite fantastic because it's much longer than what we see with conventional chemotherapy. And even more encouragingly, okay, about more than half of these women, about 60%, are still alive at 4 years. And if you recall, when we say that, historically, when we treat this group of patients with chemotherapy, at 5 years, less than 20% will be alive. So these are actually very promising results. And the study findings is perhaps very in keeping with what we are seeing in clinic when we use this type of treatment in patients with MMR mutation. I have a patient who had a metastatic endometrial cancer, I think the cancer has actually spread to the upper part abdomen. It's a fist-sized cancer in the upper part abdomen, and also a golf ball size cancer in the neck. When she came to see me, she has quite a bit of abdominal pain. She couldn't eat because the cancer was pressing on the stomach, and she was having difficulty with neck pain as well. So she started on this treatment, and 3 weeks later, when she came back to the clinic to see me, the neck mass has almost disappeared, and her abdominal pain has also completely gone away, right? And 2 years later, when we did a scan on her, there was actually no evidence of cancer. So these results are actually very encouraging for our patients. However, only 2 out of 3 endometrial cancers have the one out of 3 will have the MMR mutation, which means that 2 out of 3 do not have this mutation. So this MMR negative tumors, when you give them immunotherapy on its own, it doesn't work very well. We call this cold cancers. So to make this cold cancers becomes hot to the immune system, we can add in an additional drug to the immunotherapy. Cancers require nutrients to grow, and they make use of this protein called the VEGF proteins to help them build up blood vessel and blood supply that can actually bring the nutrients to the cancer. Anti-Angiogenic drugs are a class of targeted therapy. They work by blocking this VEGF protein, and in so doing, it cuts off the blood supply to the cancer cells and resulting in cancer death by starving the cancer cells. Okay, so studies have actually been trying to put the immune checkpoint inhibitor with this group of a class of drug. So these are patients who actually do not have the MMR mutation, right? And they treat this group of patients with a combination of immune checkpoint inhibitor and anti-angiogenics. And they compare the outcome with people that when we treat with chemotherapy, which is actually what we have been doing for many years. And they found that by having this combination treatment, they actually have better outcomes compared to chemotherapy. There's a better chance of shrinking down the cancer. There's a better at reducing the risk of the cancer growing, and patients also live longer. So this immunotherapy and targeted therapies are in fact very exciting treatments, and they are actually approved for use in the treatment of endometrial cancers because of the good results that they are showing in clinical studies. Okay, I'm just going to finish off by talking about some of the common myths about endometrial cancer. Endometrial cancer only affects older women. Therefore, I'm too young to get endometrial cancer. It is true that endometrial cancer predominantly affects older women. However, 3 in 10 endometrial cancers are in women under the age of 50, and 1 in 10 is under the age of 40. So you may not be too young to get endometrial cancer. So this cannot be endometrial cancer as I have no pain. Early endometrial cancer is not painful, therefore do not wait for painful symptoms to occur because by then it may be more advanced. Now, this cannot be endometrial cancer as none of my family members have cancers. Only 3% of endometrial cancers runs in family, majority do not run in family. So this cannot be endometrial cancer as my pap smears have always been normal, and this is actually a very common thing that patients say to me. Now, pap smear screens for cervical cancer. It does not screen for endometrial cancer. So this is a diagram showing how a pap smear is done. It collects cells from the cervix, okay, which is the lower end of the uterus. Okay, so it is a screening test for cervical cancer, and it is not a screening test for endometrial cancer, which is higher up. Okay, so what are the take-home message? Endometrial cancer's incidence has been rising and will continue to rise, and therefore increasing awareness is important. Abnormal vaginal bleeding is the most common presenting symptom, and you can get, and if you catch endometrial cancer early, most of patients can in fact be cured. So timely presentation to see the doctor is very, very crucial. Unfortunately, there are still some patients when they found out about the cancers has already spread. These are women who are less fortunate, they have metastatic disease, and the outcome generally is not as good. Traditionally, we've been treating this group of women with drug therapy. Most of the time, it is with chemotherapy. If you were to ask women with metastatic endometrial cancer what they hope the treatment would do for them, very often the women will tell me, number 1, they want to live longer. Number 2, they really actually wanted to, hoping for the fact that the treatment will actually get rid of their cancer for good, i.e. to cure them. Unfortunately, with chemotherapy, this is very often not very likely. And increasingly, doctors are actually doing more molecular testing of these cancers to help us select the best treatment for each individual cancers, because we know that no two cancers are the same. All right. New treatments such as immunotherapy as well as targeted treatment, okay, are showing very promising results, okay, and they're able to control cancers better and for longer compared to chemotherapy. And some of these women, okay, have no signs of cancers in them even months and years after the start of treatment, giving us hope that perhaps that some of these patients with metastatic disease can be cured. And with this, I'm going to end my talk, and I'll now hand my time back to Cyan.
Thank you, Dr. Lim, for your insightful sharing. We will now proceed to the Q&A session. We do have a few questions. There's one from June Pang. She asks, "Hi, Dr. Lim, may I know under what scenarios will you recommend an individual to go for a Lynch symptom testing or diagnosis, and how is the diagnosis done?"
Okay, so what scenarios? Okay, so number one, okay, if the family history is suggested, okay, and by that we mean that we take a proper family history, we'll ask them who in the family has got cancers. So we suspect Lynch syndrome, number one, if there are multiple members in the family who has got Lynch syndrome associated cancers. So generally by that we mean that 3 or more members in the family. So the family means that it's not just your parents, it includes your aunties, your uncles, your cousins, your grandparents, children, etc. Okay, so that's number one. So if you find that there are multiple members of the family who has got endometrial cancers, colon cancers, ovary cancers, or even stomach cancers, this is the time that we suspect this perhaps could be Lynch syndrome. And number two, these cancers also happen, if it happens in Lynch syndrome people, it tends to happen at a younger age. So if the family members are having cancers at a young age, for example, before the age of 50, this is another kind of suggestion or make us think that this could be Lynch syndrome. However, doing a family history is actually not very accurate. And the reason for that is because, number one, in Singapore, our families tend to be very small. We don't have very, very big family members of extended families. Number two, very often when we ask patients about their family history, we don't get a very good picture. The most common answer that we give is the fact that, yeah, I think so. I think my mother's sister has got a cancer in her abdomen. I think it is a woman's cancer, but I'm not really sure what type of woman's cancer it is. And therefore, Lynch syndrome is actually, just relying on family history itself is not very, very accurate. So in a woman who's already been diagnosed with endometrial cancer, increasingly what oncologists are doing is that we are actually screening all of these patients for Lynch syndrome, even without a significant family history. Okay, how do we screen for it? We actually check the cancers that's been removed during the surgery, send them to check to see whether or not there's a mutation in the MMR gene. Okay, if we do find a mutation in MMR gene in the tumor, then to confirm the diagnosis of Lynch syndrome, they need to go for what is called genetic testing. This will involve a blood test to check if the MMR mutation is present in the blood. Sorry, did that answer your question?
June, I hope this answers your question. Yeah. There's another question by Jamalia Ahmad. She asks, "Hi, Dr. Lim, I'm on Tamoxifen now. When I was referred to a gynae, they discovered that my uterus thickened at 15 mm for my first ultrasound. A few weeks back, when I went back for my second ultrasound, and the thickening reduced to 10 mm. Her question is there a chance of the thickening to keep on reducing?"
I think number one, there is actually a small increased risk of endometrial cancers with the use of tamoxifen, and therefore in women who are on tamoxifen, the doctors very often would have actually educated them to what to look out for. Okay, any abnormal vaginal bleeding needs to be reported. Okay, so as to your question about the endometrial thickening, now tamoxifen, as we said before, it acts like an estrogen on the uterus. I do not know how old you are, etc., but because tamoxifen actually can cause womb thickening per se, it does not necessarily mean that womb thickening is due to endometrial cancer. So you need to continue following up with your gynecologist, all right, and to monitor things, and if necessary, they may need to do further tests to exclude endometrial cancer, such as taking a sample from the uterus. And also, I think it depends, the thickening in the womb actually also depends to a certain extent on how old you are, whether you are premenopausal or whether you're postmenopausal. So in postmenopausal women, it is not normal to get a thickening that is more than 4 to 5 millimeters, but in premenopausal women, it can be normal. And it does actually, the thickness of the womb actually changes with your menstrual period as well, and which part of the menstrual cycle you are on. So just go back to your gynecologist and let them follow it up.
Thank you, Dr. Lim. I hope this answers your question, Jamalia. Along with this, since Dr. Lim, you mentioned about menopause, there's one question that I do want to ask. Is vaginal bleeding after menopause always due to uterine cancer?
I think the answer is no, as we already said in the talk. Okay, but however, vaginal bleeding after menopause is not normal, so you need to go and see a doctor and get it checked. But do not be overly alarmed, because most of the time it is not caused by cancer. Okay, after menopause, the level of estrogen in our body drops, and this causes the thinning of the lining of the vagina or the uterus. And we call this vaginal or endometrial atrophy. And this is in fact the most common cause of vaginal bleeding in a menopausal woman. 10% of the vaginal bleeding in this group of women will be due to endometrial cancer, and there are also other causes of other cancers that can actually cause vaginal bleeding, and this includes cancer of the cervix and, less commonly, cancer of the vagina or cancer of the bladder. So very straightforward, bleeding after menopause, please go and see a doctor. However, what is a bit less straightforward is the fact that when women are transitioning into menopause, that's the few years before they become fully menopausal, the period can actually become very irregular and makes it very difficult sometimes to actually determine whether this is normal or whether something more sinister is going on. So my advice to women, okay, who are, experiencing irregular periods, in their 40s or late 40s, when they think that whether it is due to menopause or not, number one, if you're concerned, go and see a doctor to get it checked, especially if you have got risk factors for endometrial cancer, such as obesity, or such as you've got family history of endometrial cancers or colon cancers, etc. Okay, some of the kind of red flags in this group of women includes the fact that when you have a menstrual bleed, it becomes very, very heavy, extremely heavy to the extent that you have to change your pad every 1 to 2 hourly, or the fact that you notice there's spotting in between the periods, or the period are lasting much longer than usual. So for example, a menstrual period that usually normally lasts for 5 days, and now it's actually taking maybe 8 days or even 10 days or longer, then I think this is time to perhaps go and see a doctor.
Thank you, Dr. Lim. We have another question from Yvonne Koo. She asks, hi, Dr. Lim, if a
Yes.
patient has relapsed second time within 1.5 years, mets to liver and lymph nodes, currently receiving chemotherapy, what are the likely prognosis?
Okay, so I'm assuming this is a cancer, endometrial cancer that's been treated, and then within 1.5 years, this has relapsed. I think, metastatic endometrial cancers, as we said before, when we try to treat these cancers in the past, when we use chemotherapy, a lot of times we cannot actually cure this cancer. It's about controlling the cancer, okay, to make the symptoms better and hopefully extend survival. However, with newer treatments available, I think it's given us more weapon in the treatment of cancers. And in this situation, very often we might like to find out a bit more about the type of endometrial cancers, what these endometrial cancers are like. Is there anything we can do to actually specifically block the growth of this cancer? All right. As I said before, okay, with these newer treatments, some of these patients actually do rather well, right? Not all, but some of these patients do rather well, and the cancer can be controlled for very long periods of time, right?
Thank you. I hope this answers your question, Yvonne Koo. There's another question from Oi Ching Tan. She wants to ask if people with breast tumor, such as radial scar, has higher risk of uterine cancer.
Oh, actually, I'm not sure about radial scars having a higher risk of uterine cancers. But in general, okay, people with endometrial cancers have a higher risk of breast cancer, and people who have a breast cancer also have a higher risk of uterine cancer. And the reason for that is because both of these type of cancers are what we call hormonally driven or hormonally sensitive cancers. They share many similar risk factors, such as obesity, not having any children, okay? And when you have obese, never had children, but it increases endometrial cancer, it also increases your risk of getting breast cancer, which is why in my clinic, when I see patients with endometrial cancers, I always advise them to actually go for breast cancer screening as well because of the higher risk. In addition, breast cancer patients, if they are on tamoxifen, also it does increase the risk of endometrial cancer risk.
Thank you, Dr. Lim. There's a question from Frostbite Cool. Is it remove all womb, the cancer will be cured?
Okay, so it actually depends. All right. So the treatment, if it's an early cancer, you remove the cancer. And if you find that at the end of the surgery, once we send it to the lab, it comes back saying that okay, the cancer is only in the womb and has not gone anywhere else. Okay, it means that this is a stage 1 cancer. Okay, and in stage 1 cancers, like I showed you earlier, there's a very, very good chance, up to 96% chance that this cancer can be cured. However, having said that, having 96% chance of getting cured means that there's also a 4% chance that the cancers can still come back, but it's only in the minority of people. So there's a pretty good chance that this group of patients can be cured. Yes.
Thank you. There's another question from Ho Ching Tan. Can fibroids turn into cancer? And what's the risk level?
Oh, okay. All right. Fibroids are very common to start off with. These are actually muscular tumors that grows in the muscle layer of the uterus. Okay. And it is very common in premenopausal women. It's estimated about 50% or even up to 70% of women, or premenopausal women, actually have fibroids. In general, in the majority of these fibroids, it is actually not cancer and it doesn't become cancers. However, in a very small minority, perhaps out of 1,000 of these fibroids, maybe 1 or 2 may become cancer. The type of cancer it becomes is a type of cancer called sarcoma. Okay, or what I call uterine sarcoma. And uterine sarcomas are really quite uncommon and they are quite rare. Okay, so how do we tell whether a fibroid, because it's so common, how do we tell or when we start getting worried that the fibroid has become cancerous? Okay, so fibroids, the growth of the fibroid is actually being stimulated or being put on by actually estrogen. So meaning to say that once a woman has reached menopause, okay, when estrogen level after menopause is usually quite low in the body, number 1, we should not see new fibroids. Okay, number 2, the existing fibroids should not grow. Okay, if we see new fibroids and the fibroids are growing in a postmenopausal woman, we always worry about a cancerous transformation. In addition, if a fibroid is growing quite quickly, that also may be a sign that it has become cancerous.
Okay, thank you, Dr. Lim. There's another question from Eva Kwek. She asks, what about late menstrual cycle for 11 to 16 days?
Sorry, I don't quite understand the question.
I think it's along the question where it's along the part where you mentioned about late menstrual cycle and having to go for checks. So she's asking, what about late menstrual cycle for 11 to 16 days?
As in a person having very long periods, is that right?
Eva, will you be able to assist on this part? I think while we wait for Eva to reply, let's proceed to the next question first. Frostbite Cool asks, why is there a sharp pain in breast? Before menstruation, the bottom part is having dull pain. Why is that so?
Okay, so some sharp pain in breast, sometimes it could be due to the hormonal fluctuations during our menstrual cycle. There's a kind of change in the hormonal level, and that can sometimes cause sharp pain in the breast.
I guess while we are waiting for Eva to answer on that, to elaborate on the question, let me ask a question. Is it possible to get pregnant after uterine cancer?
Maybe. Okay. When we treat uterine cancer, especially early uterine cancer, we treat it with surgery. Okay, we remove the womb, we remove the ovaries, and a few other different parts of the body. And it is a very effective way of treating uterine cancer. And for many of these early cancers, as we said before, it can cure many of these women. However, the surgery does make a woman infertile because you have removed their ovaries, you have removed their ovaries. Okay, this is usually not a big concern, as the majority of women with endometrial cancers are older women who have already completed their family. However, 1 in 10 women with endometrial cancer are below the age of 40. And in Singapore, there are more and more women who are delaying having their children. And in clinic, we are seeing more women being diagnosed with endometrial cancer who are actually planning to start a family. And very often, a cancer diagnosis on its own is very devastating to anybody. But for women who are planning to start a family, this is like a double blow or a double whammy. Some of these early uterine cancers may be suitable for what we call fertility-sparing treatment. So instead of using surgery to remove the cancer, we can give them a treatment with progesterone. As we said before, okay, endometrial cancers arises because there's an imbalance of the hormones when there's more estrogen and less progesterone. So you can actually give them progesterone to balance out the excess estrogen. Okay, and this may allow them to retain their fertility. However, not every type of endometrial cancer is suitable for this type of fertility-sparing treatment. So women who are interested, okay, to conserve their fertility will need to discuss with their oncologist to see if their cancer is suitable. Okay, so it needs to satisfy certain criteria. So these are generally cancers that are still very early, that's still within the womb, and especially is limited to the inner lining of the womb. It has not gone into the muscle layer. And also, the type of cancer needs to be the endometrioid type and low grade, because this type of cancers tend to respond better to hormones. So not every type of womb cancer can undergo fertility preservation treatment.
Thank you, Dr. Lim. Eva quite has answered to her question. She meant that the menstruation was late for 11 to 16 days after due date to start menstruating.
Okay, so late menses, if you are a young woman, I think number one on your mind, we need to think about, are you pregnant? Okay, so there are also many other causes of abnormal vaginal bleeding in young women. And we said a lot of times these are actually not due to endometrial cancer. Okay, there are many, it's actually not very uncommon for women who are premenopausal to have abnormal vaginal bleeding. This could be due to many different reasons. It could be due to hormonal changes. Stress can sometimes do that. Other conditions such as fibroids, etc., etc. So the question is this, I suppose, is this normal? If you find that there are other kind of worrisome symptoms, you are not feeling well, you are kind of losing weight for no good reasons, then this is the time that you might start worrying. But other than that, most of the time, it probably is not related to endometrial cancer.
I hope this answers your question, Eva. Proceeding on to the next question, Frostbite Co asks, after fibroid surgery, is it possible to conceive naturally?
I believe it is possible, but I'm actually not a gynecologist, probably not the best person to answer this question.
Okay. Also from Frostbite Co, she asks how to increase progesterone. What are the correct food intake and what food should we not take?
Okay, so I presume the question is how to increase the progesterone level in our body. So is there any food that we can take that increases the progesterone level? I think there's no specific food that you can take that will actually increase this level. And very often, I think if you want to increase the progesterone level, you may actually have to take medications. Right, so these are actually tablets that replaces the progesterone level in the body, and sometimes even they have actually got what's called the intrauterine device, that actually releases progesterone in some women. Okay, and this actually needs to be inserted into the womb.
Thank you, Dr. Lim. There's another question from Hosanna Tham. Why does lymph node around thigh has to be removed during removing of the womb?
Okay, all right. So the reason for removing these lymph nodes is because of the fact there are actually two reasons. Number one is because of the fact that if uterine cancers spread out of the uterus, okay, one of the ways it spread is through the lymph glands. Okay, so by removing the lymph nodes, number one, you can tell whether or not the lymph nodes has actually gone beyond the uterus, and this will help to decide what type of treatment is needed after the surgery. Number two, if there's lymph nodes if there's cancer in the lymph nodes, possibly by removing lymph nodes, you're actually treating the cancer as well.
Okay, thank you, Dr. Lim. I hope this answers your question, Hosanna. Maybe I can ask another question. Is there can uterine fibroids turn into cancer?
Oh, okay. I think just now I already answered that. I think one of the somebody actually asked the question earlier. Yes, I think the cancer, yes, but it is not common. It's very rare. Maybe 1 in 2 out of 1,000 of these fibroids may become cancerous, but it's really quite uncommon. Okay, the great majority of uterine fibroids are not cancerous.
Okay, thank you, Dr. Lim. And maybe we'll take in one last question from Eva. Does hysterectomy cause organs inside to
draw? Yeah, okay. So by removing the womb, yes, I think the organs above it may actually fall down to occupy the space. So the organs that fall down are usually the intestines, and there are many of the intestines. So we actually fall down to take the place of where the uterus uterus used to be. Okay, I think hysterectomy means removing the uterus. Yeah.
Okay, thank you. Maybe one last question. Is stage 4 uterine cancer considered terminal?
Okay. Usually when patients ask me these questions, first of all, I will ask the patients what they mean by terminal. And because terminal means very different things to very different people. In terminal, some people may mean that, does it mean I've got a month left to live? Does it mean I've got 3 months left to live? Or does it mean that I one day die of my cancer? All right. So as I said before, stage 4 cancers are cancers that already spread. Okay. In this group of patients, a lot of time we may not be able to cure this cancer. All right. At some point in time, many of these women will likely succumb to their cancer. However, many of these women, we can actually control their cancers such that they can live with their cancer. All right, especially with these newer treatments like immunotherapy and the targeted treatment, we are seeing that more and more patients with cancer can be controlled for longer periods of time. Okay, months, and sometimes we are saving years or even longer. And therefore, to answer that question, uterine cancer, a stage 4 uterine cancer, may not always be terminal. Okay, people can in fact live with this type of cancer, all right, and continue to enjoy a good quality of life.
Okay, thank you, Dr. Lim. Yeah, thank you so much for your answer and for your sharing. Our Q&A session will now come to an end. And thank you so much for joining us today, Dr. Lim.
You're most welcome. It's been my pleasure.
Before we end, we would like to share some updates. We will be having a campaign Facebook Live talk on the 13th of November. It is about Prevent, Detect and Fight Colon Cancer by Dr. Thomas So from OncoCare Cancer Centre. So do mark your calendars and we hope to see you then. Do remember to like and share the social media platforms for both 365 Cancer Prevention Society and OncoCare Cancer Centre. We will appreciate your feedback for today's session. Please help us fill in the feedback form by scanning the QR code or by clicking onto the link in the comment section. We have now come to the end of our Facebook Live. Thank you all for tuning in, and we hope that it was an informative and meaningful session for you. Please stay safe and have a good weekend. Goodbye.